Hi, good afternoon. We're going to go ahead and get started. And the first two people we are going to have is Jenny Hobbs, who's the co-founder for the Advocates for Medically Fragile Kids in North Carolina, and mom of Melanie, Michael, Meredith, and Madison, and Stacy Taylor, Juris Doctorate, Deputy Director, is that correct? Deputy Director, Office of Genetics and People with Special Healthcare Needs in Maryland, Department of Health, and mom of Faye, Ben, Marshall, and Sam. Welcome.
Hi, good afternoon, everybody. We have a real crowd here today, right? Out if you can't, you know, get a crowd of people. Hopefully, some more people will come in. So, first of all, I did want to start the session overall by saying that Medicaid is so very complex. I mean, there are reams and reams and reams of paper with rules and regulations. I started writing a list of the stakeholders that would be involved in any conversation or regulation or law change about Medicaid, and it was so long, we would have been here for 30 minutes just reading the list of stakeholders. So, all of that to say that Jenny and I are going to try to distill this into like a 30-minute conversation and have some time for some questions and answers. But what we really want to do today is give you the tools to be able to find the information for yourself, for your state, and um, so, so our objectives and some ground rules for today, we want to learn the basics about Medicaid, learn about Medicaid Waivers program, and learn how, oh, that's a duplicate there, learn how to find state-specific information so you can find the information you need in your state. And then for some ground rules, I think we all know this by now. This is a faith-based, judgment-free, confidential. And if you do need anything, I was joking about the massive crowd, but if you do need anything to make the presentation more accessible to you, please do. Um, so what is Medicaid? Does anybody care to venture a definition other than what's on the screen? Yep, it's pretty basic. First of all, I will say that Medicaid and Medicare are different. Does anybody know the difference between Medicaid and Medicare? That is not correct. It's not wholly wrong, but it's also not wholly right. Okay, no, but thank you for playing. Thank you for participating. Does anybody know the difference between Medicare and Medicaid? Right, I know, we should have like some candy information. The difference between Medicaid and Medicare. Okay, did everybody hear what Howard said? I'm going to paraphrase a little bit. Medicaid is for poor people. Medicare is for old people. That Howard's on Medicare, and these people. That is very much oversimplifying. But Medicaid is low income kids, adults, seniors, people with disabilities. Medicare, very much oversimplifying. Older people. There you go. Now, we started this with Medicaid is very complex. To not want to go on Medicaid. Absolutely. Yes. Yes, absolutely. And that's Rethink Medicaid. That is the title. But Medicare essentially is for older adults. Medicaid is for low income or people with disabilities, including children. So it helps millions of Americans get and stay healthy. It essentially pays for medical care, including primary care, prescriptions, therapies, etc. And as of March 2023, almost 87 million individuals are enrolled in Medicaid. So what is Medicaid? We're not talking about Medicare anymore. What is Medicaid? I'm going to do just a little bit of an overview, and then Jenny's going to get into the nitty gritty of the waivers. She's the smart person. Well, of the two of us, like everybody. Medicaid was enacted in 1965 as part of the Social Security Act. This was a good one. The Social Security Act gave us a lot of things, including Medicaid, Medicare, unemployment, the maternal and child health block grant, which I know about this because that's what I work on in my job outside of being mom to Ben, Faye, Marshall, and Sam. Medicaid is a joint federal and state program. So you were right, in part, it is state. Medicaid is administered by the states according to federal requirements. So essentially, federal law tells states what they have to do, and then the states have to submit a plan that says how they're going to do it. So the federal law, the Social Security Act, states you have to provide insurance, you have to provide care for low-income individuals, children who are sick, pregnant women, etc. But that's it. Like these are like kind of the federal, these are the guidelines. These are our parameters. These are certain requirements that must be met. And then the states can come along and say, okay, well, we're going to do that, but also we're going to do this. And then the states can decide what other populations they may provide Medicaid coverage for. They can decide about the Medicaid waivers, which Jenny will be talking about, but they do have to submit it as a state plan to the federal government, and the federal government has to approve it. So, how many different Medicaid programs do you think there are? Yes. I wish I did have some chocolate. Yes, there are many, many, many different Medicaid programs. So, and thus is as saying managed in the Medicaid program. If you've seen one Medicaid program, you've seen one Medicaid program. And that is why in a 30-minute conversation, we're not really going to be able to dive too deep into specifics of what each situation of yours would entail. But Jenny's going to give you the information for how you can find it within your state. And for Medicaid and CHIP, again, this is a generalization. Medicaid eligibility is generally based on income. There are, as we're going to talk about during this conversation, waivers for children with medical needs, but enrollment in Medicaid is largely based on income. The Children's Health Insurance Program, which was signed into law in 1997, provides federal matching funds, so states can provide health coverage to children in families with incomes that are too high to qualify for Medicaid. So it's that kind of that you're too rich to qualify for Medicaid, but you're too poor to afford health coverage with your private insurance plan. And it's become a significant part of our population these days, where you don't, the co-pays are sending you in bankruptcy, but you still qualify for Medicaid. So the Children's Health Insurance Program will assist with that. So I believe, I think all states have expanded children's coverage through CHIP. So states determine within those federal guidelines, states determine how they're going to deliver the care to their Medicaid enrollees. So if any of you are enrolled in Medicaid, or you have children who are enrolled in Medicaid, they may be enrolled in a managed care organization. That is how it works. I'm in Maryland, so that's how it works in Maryland typically. Medicaid enrollees are enrolled in a managed care organization. Some other states or some specific programs within the Medicaid universe may be a fee-for-service, where the state is contracting directly with the provider. So the state contracts directly with Dr. Goldstein. I'm using her as an example. The state contracts directly with Dr. Goldstein. My son goes to see Dr. Goldstein. The state pays Dr. Goldstein. There's no middleman. There's no managed care organization. That's it. With the managed care organization, they sort of serve as that insurance. So you get a managed care organization, they serve as your insurance company, and that's your provider has to accept that. The state can also choose to provide premium assistance, where funds are used to purchase private insurance that's cost effective and profitable, which Betty's going to touch on a little bit more later. And then states can use a combination of these approaches. So again, you would have to look at the specifics within your state. I know in Maryland it's managed care. I think you said in North Carolina it's a combination. So you would have to look at the specifics for. So why do you want Medicaid for your loved one with complex medical needs? That's really what we're talking about. Not why do you want Medicaid for yourself, unless you aren't. Why do you want Medicaid for yourself? Well, it's not just to support poor. It's not just for women. It is for people that have complex medical. And it can serve as your standalone health insurance. So instead of having Care First Blue Cross and Blue Shield, you have Medicaid. And then the delivery of care is determined based on state, whether you're enrolled in a managed care organization or a fee for service and you just have straight Medicaid. It can be your secondary health insurance, where you may have Blue Cross and Blue Shield, but you also have Medicaid, and then anything that Blue Cross and Blue Shield doesn't pay for, Medicaid will supplement. And it can provide coverage for inpatient and outpatient hospital services, physician services, everything that you need. I'm not going to read that whole list to you. You guys know how to read. And for the most part, it is no copays for children and minimal copays for adults once enrolled in Medicaid. And with that, we're going to talk about Medicaid waivers. So we know like what Medicaid is, right? How it originated, what it is, why we want it. Any questions so far? So how do you get it, right? How do you get it?
So Medicaid waiver. So if you first for Medicaid waiver, you may have thought that waiver, right? Person, sorry, my voice isn't very that well. When I first heard about Medicaid waivers and what they were, I always thought that waiver is because it waives the parent income. And for the most part, they do, but that's not actually why it's called a waiver program. It's called a waiver because it gets to waive certain statutory requirements from CMS. I'm not going to read all of this because it's in your slides and it's in the app and all these are available to you. So I don't need to waste your time on that. But for the most part, there's a few specific waivers we're going to talk about today. So the 1915B waiver is the one that generally is the managed care waiver. Since we were talking about that, because here talk about a 1915B waiver, that's generally when your state is moving to a managed care program. That's how they are seeking authorization from CMS, which is the Centers for Medicare and Medicaid Services. That's the federal government oversight. So that's that application that they're using to get permission for using managed care. 1915C is one of the ones we're going to talk about more in depth. That's the one for home and community-based services. 1115 waivers are a demonstration waiver that can sometimes be used for home and community-based services as well. I'm not going to really dig into that one because it's a lot more encompassing and it's not specifically for home and community-based services. It can include that, but it doesn't have to. And then TEFRA is the last one that we're going to talk about. That one's also known as the City Beckett waiver, if you've ever heard that term. There are other 1915 waivers like I, J, K, and we're not going to get into those, but if you've heard those terms, just know that Those are generally strictly state-based and state-funded unless they were grandfathered into a previous federal program. So these other ones are a state and federal partnership, which means the state and the federal government are funding them together. But these other ones that we're not going to talk about are completely state funded unless they were grandfathered in. So the TEFRA Katie Beckett label, and this is actually a picture of Katie Beckett. TEFRA stands for Tax Equity and Fiscal Responsibility Act. So not every state has a TEFRA Katie Beckett waiver. North Carolina actually does not, but South Carolina does, if you're from this area. This is a waiver that's only for children. Eligibility is strictly based on their diagnosis. It does not look at parent income, only looks at the income or assets of the child. There's no wait list, so if you meet the qualifications, you automatically get it right away. But generally, you only get Medicaid, so you don't get any of these extra services that we're about to talk about. Sometimes there are additional services tied to it, but not always. I'm going to show you how to find more state-specific information in a minute. So, home and community-based services waivers. These states can develop these waivers to meet a wide variety of needs, and they're given a lot of flexibility from the federal government about how they put this together. These can be available for just children, just adults, or children and adults under the same waiver. Eligibility is based on level of care, including a diagnosis. The diagnosis alone is not necessarily enough to qualify. Generally, they're looking at, are you also sick enough to require some kind of institutional level of care? And while that is a really scary term, and I work in that world all the time, just as an example, if you've seen my children who can walk, talk, and generally take a lot of care for themselves, they qualify for institutional-based care. So just because of all of their, they require a lot of nursing skills throughout the day, a lot of nursing tasks. That makes it institutional level. So they don't have to be like, I'm putting my child in an institution tomorrow if you don't give them services because they're that sick. So just know that term is scary, that's not necessarily what it means. And if someone tells you your child needs institutional care, know that that doesn't mean that is the only option available, like from the community-based services. So many families that hear that term and they're like, oh my gosh, like that's the worst thing possible that you could tell me about my child. So most states offer a home and community-based service. Every state, every state either offers TEFRA or home and community-based service. So there is one of these waivers available in every single state, but not necessarily both. So like I said, North Carolina offers 4 home and community-based, actually, yes, 4 home and community-based services waivers. So it might not even just be one, there may be multiple ones, but not TEFRA. North Carolina, South Carolina offers, I think, 2, I don't know off the top of my head, but I think 2 home and community-based services waivers and TEFRA. So there might be a mix and match. There might be just TEFRA. Idaho only has TEFRA and no home and community-based services waivers. It's the only one I remember that only had that situation. But so just know that there is a waiver available in every single state. Yeah. 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 One of the big distinctions between Katie Beckett and TEFRA and these waivers is that there might be a waiting list. And it might depend on the specific waiver as well. Within North Carolina, we have 4 waivers. One has up to a 12-ish year waiting list or more. Some of the waivers only are still covering certain counties. and then one of the waivers does not have a waiting list at all. So it just kind of depends. I'm not sure how long the CAPUA waiver is, so I don't really have insurance on that. And some of those wait lists depend on the county you live in versus, statewide. So it can very much depend, not just even on your state, but even in the county you live in. Like I said, these are going to give you Medicaid without taking in parent income into consideration, but they will look at the child's income and assets. So if you attended the financial talk earlier, it was talking about making sure, looking at, you don't want to make sure that any kind of yeah, and if something if a grandparent dies, you don't want them to like leave money to your child and all of a sudden they wouldn't be eligible, that kind of thing. So you just need to be mindful of that. So these are some of the services that are available with most community-based services waivers. So case management is one I'm going to go into a little bit more in depth because Linda has asked me to, and that's what I do with my diet. Either having home health. I did not list private duty nursing here because that is actually a state plan Medicaid service that is federally required within Medicaid programs to be provided to have not ever a waiver service because you're going to already get that through Medicaid. Personal care, adult day programs, rehabilitation, respite care, some other things like home and vehicle modifications, assistive technology, car seats, tricycles. It's like stretching feet. Wait for my husband to be here this weekend doing a waiver, so things like that. So what kinds of things can your case manager help with? So like I said, this is what I do for my job all day long. So I assist families with referrals for in-home care. So for someone to come in and help with your child, either for you to leave to go to work or for you to just get a break because you need to get out of the house every now and then. I put in referrals for therapy, for equipment, for supplies. I can follow up on issues when there's problems going on with any of those things. I help teach families how to stay organized with all of those things. Connect them to local resources and to a support group if they need something that's not covered by the waiver, but it's some kind of service or supply that they need. Reaching out to local nonprofits to try to get items covered. I get to refer to Make-A-Wish organizations. I've connected families to research studies before. Of course, there's a ton of training about what kinds of things they're eligible for within our waiver and within Medicaid. And then as a parent, I would just say, because I have 3 kids that are in our Medicaid waiver program, that I know how to do all of these things because it's my job. But I also know it's hard to recognize sometimes that even if I know how to do these things, that it's okay to let go of some of these things and ask for help because that's what they're there for as a resource. And also to just give myself some space and allow myself some extra time to do some other things maybe I need time to do. So I just want to put that out there. It's okay to let your case manager help you with the things that they are perfectly capable and able of doing for you. You don't have to be the one that's like calling around all the different interval companies to find out who can carry the specific formula that you need. Let them do that for you. Utilize them as much as you can. I'm almost done. But sorry. Okay, I just want to make sure everybody knows how to find what you need about your state. So, great website. I know the owner of the website and who manages it. It's called kidswaivers.org. This is our website. We didn't know how technology was going to work, so I just put screen grab to walk you through how to find your state's information. So this is our homepage. If you click on state pages right there's a drop down box. You can find your state alphabetically. So I'm doing North Carolina here. So you can see I click on North Carolina. I'm going to get to the North Carolina page. It's going to tell you a little bit. I don't know if this is. I was trying to find the. Yes. two little hyperlinks right here with some advocacy organizations in North Carolina. For every state, they'll have their advocacy organizations listed there. So if you have any questions or concerns or problems in your state, trying to find more information, or if you're having concerns or problems with your waiver, they'll have they'll have any links there to get in touch with in your state. That's my organization. So, and then they'll list all the different waivers within your state. And underneath there, and then you can just click on the drop down there. This is Cat C. This is the medically fragile children's waiver for North Carolina. So you can see it lists out all the information about it. This is actually the old version, because we just updated our waiver a couple months ago. And Susan manages this website currently on her own time for free, and she's in the process of updating this summer. So this is a little bit old information, but it'll tell you the target population for children who are medically fragile technology dependent. It'll tell you the age, the level of care, the income waiver. So yes, the waiver is based on child income only. The waiver type. So this one is a 1915 C. Remember we talked about that, so now you know what that is. How many waiver stacks there are. So our waiver had 4,000. It's just been expanded to 6,000. Expiration date. So technically our waiver expired a year ago, but our state is slow to renew, so it just got renewed in April. It'll tell you the description from Medicaid.gov. It has hyperlinks to the CAT-C program, which is your state's program, a hyperlink to the official federal information on the federal CMS website, how to apply, whether there's a waiting list or not. It does talk about there being a waiting list in North Carolina. You see, it does say this waiver to the state does not have a waiting list. And then if there's a specific advocacy group for that particular waiver, it'll list it there. So that is the best way that I know to find waiver information on your state. It is amazing. But it's not as easy to read. Right. This is which is linked on the page.
So the things to consider, well, first, the size line and we don't know. Check out his favorite classes, check out his Medicaid, see if there is
And then yeah, so the health insurance premium payment program is, I can't tell you for sure that it's in every state, but it's in a lot of states. And it's definitely in North Carolina if you're in North Carolina. So if your child is on Medicaid, whether they have if they have private insurance through an employer, so you can't go buy health insurance just privately or off of the ACA exchange. But if you have it through an employer, you can apply for this program, and it will. And this is not just a North Carolina program; it is a federal-wide program. But it will Medicaid will review and see if it is financially advantageous for them to pay your health insurance premium for you to keep your child on your private insurance. And a lot of times it is, because your health insurance premium, let's say it's $2,000 a month, as an example, but your child's healthcare costs might be $5,000 a month. So it's cheaper for Medicaid to pay your $2,000 a month health insurance premium and have your private insurance pay that $5,000 a month than it is for Medicaid to pay all $5,000 a month of your child's health care. So they'll do that math. They'll ask for your child's diagnoses. That's how they'll do that determination. And if they decide that it's worth it to them to pay your health insurance premium, then all you do is you submit your pay stub once a month to show that you're continuing to pay your health insurance, and then they reimburse you every month. And it's wonderful. So it saves us a lot of money over the years. So, and like I said, that's not just in North Carolina. I know that is across the country. So it's called the Health Insurance Premium Payment Program. So just Google your state and then those 4 words and see if it's available in your state. And with that, we'll take some questions real quick. Go for it, Taylor. Yeah. Oh, wow. Yeah, it often will. Yeah, it'll do the whole family. Yeah, not just for your child. Mhm. Well, because it's often not broken down by individual, so they could pay the whole thing. So, yeah. Just to know, I mean, I guess I always encourage my patients to be on the innovations waiver waiting list, because the budgets available to you within that program are even better than CAPC, and because the waiting list is so long. But if you're late getting on, I had a patient last year that had not been on the waiting list, and it for CAPC for our medically fragile waiver. You age out at your 21st birthday, so you have to go somewhere else. You know, that you have to go on to another waiver program. And so for North Carolina, we have a disabled adults waiver, or we have the innovations waiver that serves children and adults. And so we had, I had a patient that was about to age out of Cat C and hadn't been on the innovations waiver waiting list at all. And we were able to get him apply, become eligible, and transition to innovations in 6 months. Because if you're on Cat C, because you would essentially lose your eligibility for Medicaid and be without a home community-based services waiver and be at risk of institutionalization at that point, they're granted a certain number of emergency slots every year to transition over Cat C recipients. So we were able to do that, but that's not ideal because that's not 100% guaranteed that that can happen. But I've actually been able to have that happen twice. So, but I would not depend on it. So I would get on the waiting list. Your LME MCO, which is on your Medicaid card, it's who manages behavioral health for your county. You're Mecklenburg, right? I think it's still Partners, right? I think Partners is no. Your LME MCO is who manages behavioral health for Medicaid for your county, and it'll be on your Medicaid card. Yeah. You're going to want to apply for whatever state you're residing in because that's where she would receive services. Um, so in terms of like looking at home and community-based services, it's going to be where you live, not necessarily where you're. Yeah. Um, I mean, I'm always a fan of applying for SSI when turning 18. Um, but I don't know much about military benefits, so I want to get a start on Sure. Yeah. Yeah, there's definitely a baseline of what every state has to cover, but then above and beyond, there's definitely yeah.
case manager official but that was one of the things that our case manager did. She assisted with show how the involvement is. So I don't know how to do
I mean, I will say in North Carolina, we got it added as one of our waiver services. So it still requires paperwork. I mean, ideally, the easiest way to do it is to get it covered under legislation, because then it's covered under just general Medicaid for anybody. And then it's much more readily available without all the added paperwork. I'm guessing if your case manager had to fill out a lot of paperwork, it wasn't because it was readily available either in Maryland. So, yeah, so legislatively through your General Assembly is going to make it the most accessible to everyone. So, yeah. Under participant goods and services, we got that language added. Vitamins and supplements have been added. Your case manager is going to kill me because it's a lot of paperwork. But yeah. I was just going to say real quick, we did have some extra resources. In your app, we also included a glossary of terms just to kind of help you guys be familiar with the language used in Medicaid. And this is also the QR code for that glossary of terms, but it's also in your app as one of the downloads that you can grab. It's like 12 pages of a glossary of terms. So hopefully that will help you to be familiar with the language as you're reading into the information about your state and you come across a word you don't understand. Hopefully it's in this glossary of terms.